Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a general practitioner, GP, talking to a patient named Mr. Dan about a suspected skin infection. For questions 1 to 12, complete the notes with a word or short phrase that you hear.
Good afternoon, Mr. Dan. I understand you're here because of some issues with your skin. Could you tell me more about what's been happening?
Yes, doctor. I have this red, swollen area on my left leg. It started as a small bump, but it's been getting larger and more painful over the past few days.
I see. Have you noticed any warmth around the area or any discharge?
Yes, it's definitely warm to the touch, and just this morning I noticed a bit of yellowish discharge coming from it.
That sounds like it could be a bacterial infection, possibly cellulitis. Cellulitis often causes redness, swelling, warmth, and sometimes discharge, especially when it becomes more severe. Do you recall any recent cuts or scrapes on that leg?
Actually, I did scrape my leg while working in the garden last week. I didn't think much of it at the time, but maybe that's how it started.
It's very possible. Even a small break in the skin can allow bacteria to enter and cause an infection. We'll need to start treatment to prevent it from spreading further. I'll prescribe a course of antibiotics for you to take orally.
All right. How long will I need to take them?
You'll likely need to take the antibiotics for about a week. Make sure to complete the full course, even if the symptoms start to improve, to ensure the infection is fully cleared. Additionally, keep the area clean and avoid touching or scratching it to prevent further irritation.
Understood. Is there anything else I should do to help it heal?
Yes, try to keep the leg elevated when you're resting, as this can help reduce the swelling. Also, monitor for any increase in redness, pain, or swelling, as that might indicate the infection is getting worse. If that happens, come back right away.
Thank you, doctor. I'll follow all your instructions.
Good to hear. We'll also set up a follow-up appointment in about a week to see how you're responding to the antibiotics.
Extract 2. Questions 13 to 24. You hear a pediatrician talking to a mother named Mrs. So about her child, LIêN, who has been diagnosed with dengue fever. For questions 13 to 24, complete the notes with a word or short phrase that you hear.
Good morning, Mrs. So. I understand LIêN has been feeling unwell. How is she doing today?
Not very well, doctor. She's had a high fever for the past 3 days, and she's very weak and lethargic. She's hardly eating or drinking anything.
That's concerning. Dengue fever can cause high fever, along with symptoms like body aches, fatigue, and a loss of appetite. How has her fever been? Has it fluctuated?
Yes, it goes down with medication, but it comes back up a few hours later.
That's typical in dengue. The fever usually lasts for about a week, and it's crucial to keep her hydrated, as dehydration is a major risk with dengue. Is she drinking any fluids?
I try, but she resists, and it's hard to get her to drink enough.
In that case, encourage small sips frequently. You can also give her an electrolyte solution to help replace the fluids and salts her body needs. If her condition worsens, we may need to consider hospitalization for intravenous fluids.
I understand. I just want her to get better as soon as possible.
We'll monitor her closely, especially for any warning signs like persistent vomiting bleeding gums, or abdominal pain, as these can indicate severe dengue. If you notice any of these symptoms, bring her to the hospital immediately.
Thank you, doctor. I'll keep an eye out for those signs.
Good. It's also best to keep her resting and avoid giving her any aspirin or ibuprofen, as these can increase the risk of bleeding. Stick with paracetamol for now.
Got it. Thank you for the advice.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer, a B or C, which fits best according to what you hear. Question 25. You hear a nurse discussing a patient's symptoms with a student intern.
Mr. Harris has been complaining of abdominal pain and nausea. His symptoms seem to get worse after meals.
Should we monitor his food intake or adjust his diet?
Yes, let's start by keeping a record of what he eats. Also, notify me if his pain increases or he reports any new symptoms.
Understood. I'll also ask him to avoid any heavy or spicy foods for now.
Good idea. That should help us identify any triggers.
Question 26. You hear a physician discussing a medication adjustment with a pharmacist.
Mrs. Lee's blood pressure hasn't improved with the current dose of her medication.
We could consider increasing the dose or adding a second medication.
That makes sense. We'll also need to check if he's experiencing side effects that could be causing him to skip doses.
I'd prefer to try increasing the dose first and monitor her response. If there are any side effects, we can reassess.
Agreed. I'll prepare the updated prescription and inform the nursing team.
Question 27. You hear a physiotherapist explaining an exercise plan to a rehabilitation assistant.
Mrs. Taylor is still experiencing difficulty with her range of motion.
Should we try incorporating some resistance bands to strengthen her muscles?
Yes, but start with the lightest resistance. We don't want to strain her muscles.
Understood. I'll assist her during the exercises to ensure she's comfortable.
Perfect. Let's keep a close eye on her progress and adjust as needed.
Question 28. You hear a junior doctor consulting a senior physician about a patient's test results.
The test results show elevated liver enzymes. Could this be due to the patient's medication?
It's possible, especially if he's been on high doses for a prolonged period. Let's review his current medications.
Should we consider reducing the dosage or switching to a different drug?
Yes, let's reduce the dose first and schedule a follow-up test to monitor the levels.
I'll make a note to arrange the follow-up in a few weeks.
Question 29. You hear a clinical assistant discussing a wound care protocol with a nurse.
Mrs. Clark's wound is healing, but there's still some redness around the edges.
We should continue with the dressing changes daily. Let me know if there's any increase in redness or if you notice any discharge.
Should I apply any antibiotic ointment as well?
Not yet. Let's see how it responds with just the dressing. We'll reassess if the redness doesn't improve.
Question 30. You hear a dentist discussing a treatment plan with a dental assistant.
Mrs. Evans has significant plaque buildup, which is causing some gum inflammation.
Should we start with a scaling procedure?
Yes, that's essential. After the scaling, let's provide her with instructions on oral hygiene to help prevent recurrence.
I'll prepare the necessary tools and go over the instructions with her afterward.
Great. Make sure to schedule a follow-up in a few weeks to check her progress.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with Dr. Singh, an ENT specialist, discussing upper respiratory infections and prevention methods.
Thank you for joining us today, Dr. Singh. Upper respiratory infections are so common, especially in colder seasons. Can you tell us a bit about what causes these infections?
Certainly. Upper respiratory infections, or URI, include conditions like the common cold, sinusitis, and pharyngitis. These are usually caused by viruses, though bacteria can also be involved in some cases, particularly with sinus infections or more severe sore throats. Viral infections spread easily through droplets in the air or by touching contaminated surfaces and then touching the face.
So it sounds like they're quite contagious. What are the typical symptoms that patients experience?
Yes, they're very contagious, especially in close contact settings like schools or offices. The typical symptoms include a sore throat, nasal congestion, running nose, coughing, and sometimes a low-grade fever. Symptoms usually resolve on their own in about a week, though bacterial infections may require antibiotic treatment.
What do you recommend for preventing these infections, particularly in high-risk groups like children or the elderly?
Good hygiene is crucial. I always emphasize frequent hand washing, especially before meals and after being in public spaces. For children, it's essential to teach them to avoid touching their faces and to cover their mouths when they cough or sneeze. In addition, keeping surfaces clean in the home can help reduce the spread of viruses.
Those are helpful tips. Are there any other prevention strategies for people who are especially prone to these infections?
Yes, maintaining a healthy immune system is also important. Regular exercise, a balanced diet rich in fruits and vegetables, and adequate sleep all contribute to a stronger immune response. For high-risk individuals, such as those with asthma or chronic respiratory issues, getting an annual flu vaccine can also be beneficial in preventing complications.
And what about the role of medications or supplements like vitamin C or zinc? Are these effective in preventing upper respiratory infections?
There is some evidence that vitamin C and zinc may help reduce the duration of symptoms, but they don't necessarily prevent the infection from occurring. I usually advise patients to focus on a balanced diet instead of relying on supplements. For most people, supplements are not a substitute for proper hygiene and a healthy lifestyle.
Thank you, Dr. Singh. It's clear that prevention is about a combination of good habits and a healthy lifestyle.
Absolutely. A holistic approach is the best way to minimize the risk of upper respiratory infections.
Extract 2. Questions 37 to 42. You hear a nutritionist giving a presentation on strategies to prevent E. coli infections and other foodborne illnesses.
Good afternoon, everyone. Today, I'd like to talk about preventing E. coli infections, which are a significant concern in food safety. E. coli is a type of bacteria that can cause severe gastrointestinal infections, leading to symptoms like stomach cramps, diarrhea, and even kidney issues in severe cases. One of the most important steps in prevention is proper food handling. E. coli often contaminates raw meats, especially beef, so it's essential to cook meat thoroughly to kill any bacteria. Ground beef should be cooked to at least 160 degrees Fahrenheit. It's also crucial to avoid cross-contamination by keeping raw meat separate from other foods, particularly fruits and vegetables, which may be eaten raw. Hand hygiene is another key factor. Washing hands with soap and water before handling food and after using the bathroom can prevent the spread of bacteria. This is especially important in households with young children, as they're more vulnerable to severe infections. We should also focus on washing fruits and vegetables properly. Even if produce looks clean, it can still carry bacteria. Rinsing under running water can help, but for certain items like leafy greens, a soak in a vinegar solution can be beneficial. Finally, staying informed about outbreaks is essential. In cases where E. coli outbreaks are reported, it's best to avoid the specific foods or areas associated with the contamination until the issue is resolved. Prevention is about awareness and careful habits in both food handling and hygiene.
That is the end of the listening test. You now have 2 minutes to check your answers.
AVN Pharma Education.